So 1 to 6 months is a good age for pacifiers, and it is recommended that health professionals or other parents should not actively discourage use of pacifiers because it could be a lot of help during this 1 to 6 months of age. Namaskar parents, I am Dr. Deepesh Prajapati, dentist just for kids, practicing in Jaipur, Rajasthan since 2013. Let's discuss in this video that what are pacifiers, are they beneficial, what harmful effects does pacifier have, and when to start and when to stop with pacifiers. See, pacifiers, as I have told, have benefits also and disadvantages also. First I'll discuss the advantages and disadvantages, and in the end of the video I'll tell you what the recommendations say that when and how to use a pacifier. See, main benefits of pacifier is, we all know, is it soothes the child who find it difficult to sleep or they cry a lot. They usually find pacifier. Few kids accept pacifier as a good soothing agent, and parents often give it to soothe the baby and let the child sleep. Another thing which pacifier helps in is pain control. If the child is undergoing any vaccination, any injections or any painful dressing, it is found that if the child has given a pacifier, it soothes the child and the pain threshold increases and the child is more comfortable. Research has also found that kids who are on pacifiers have a shorter hospital stay compared to the kids who do not use pacifier. Another, probably which general parents do not know, is it prevents sudden infant death syndrome. Lot of research has found that the kids who are on pacifiers do not go through SIDS, which is sudden infant death syndrome. You can probably ask your pediatrician more details about it. Coming to what disadvantage does the pacifier carries it. See, the main disadvantage which pacifier can cause is interruption with the natural breastfeeding. If the pacifier is started too early in the life, before the child gets trained into getting the breastfeeding done, it might start interfering with the normal breastfeeding. Another thing which can cause by prolonged pacifier use is middle ear infections. So there is a certain age group where the doctors start recommending to stop or reduce the use of pacifier because it can cause middle ear infections as well. Another thing which probably everyone knows is, and being a kids dentist I'd like to emphasize on, prolonged use of pacifier after a certain age group can cause permanent damage on the jaws, face and the teeth. So, and which eventually you need to get corrected somehow with the braces in the later age of the life. So most of the organizations, big organizations of pediatricians like American Association of Pediatric Dentistry, American Association of Pediatrics, they recommend that do not start the pacifier before the 1 month of age because it might interfere with the breastfeeding. Till that the child has not even learned how to breastfeed well, and if you start giving pacifier, he might get confused and the oral training goes wrong. So do not start pacifier before 1 month of age and start discouraging it after 6 months of age. So 1 to 6 months is a good age for pacifiers, and it is recommended that health professionals or other parents should not actively discourage use of pacifiers because it could be a lot of help during this 1 to 6 months of age. So start discouraging after 6 months of age. If the child continues after 9 to 10 months of age, it is found that the higher chances of having middle ear infection starts in those kids. And if the child is still using after the age group of 4, as I said, the jaws, the teeth and the face might get permanently damaged. So 1 month to 6 months age group is a good age group to use pacifier to soothe your kids and extract the maximum benefits what a pacifier can cause. Whenever we are buying pacifiers, please look for physiological or orthodontic pacifiers. They are in a particular shape which minimizes the damage on the teeth and the forming jaws for such kids. If you have doubt related to the same topic, you can either email me on the given email ID or put your doubt in the comment sections below. I will definitely try to help. Namaskar. My advice is to all the parents is, please do not coat the pacifier with any sweetening agent or do not use nipples which are available in market which have honey inside it. Please, it will damage the teeth, it will cause huge cavities, and treating complex cavities in very young age group kids, it's not easy.